I think that all of the strategies, both from Get With The Guidelines and Target Stroke, raises the bar on your patient care. The face of stroke looks a lot like this room. It doesn't discriminate race, color, creed. It just affects everybody, every time, at any time. One of my favorite stories is a 42-year-old woman who was crossing the street on her lunch hour, a very busy street in Los Angeles, and she actually fell in the middle of the street. She suffered a stroke in the middle of the street. They brought her to Cedars. We worked her through our system very quickly, and she was given TPA, using a lot of the strategies, quite frankly, from Target Stroke. That's how we got her through the system so quickly. And she was taken upstairs for thrombectomy, and when she woke up, she came in with no speech and no use of her left side. And when she woke up, she was completely 100%. So that was a great save. That was a great story. We were looking at pursuing primary stroke certification. And when you do the research, the first thing that pops up is Get With The Guidelines. So I reached out to the American Heart Association. I was on the team when we first started the stroke program. And I actually put the first patient into Get With The Guidelines database. I personally put the first patient into Get With The Guidelines database many years ago, and now we have over 8,000 patients in our database, which is really pretty amazing. We had no idea how big this would get. We had no idea how this would grow. We had no idea we would be one of the largest stroke programs in the country. I'm really passionate about it because I think that Target Stroke changed the way medical centers treat their stroke patients, and that's a really big deal. It saved a lot of people. This initiative really appealed to us because even though we had already formalized our informal processes in terms of stroke patients getting through the pathway, coming in through the emergency room, getting to CT, getting treated quickly, we did not begin to really drill down and look at all of the steps and everything it took until Target Stroke. And we realized, oh, wait a minute, we could really save time here. We could really sort of accomplish this way, and I think through Target Stroke it helped us to really create a better system. We probably would not have maybe drilled down and shortened our median door to needle time was like maybe 64 minutes, and now it's like 42 minutes. That's amazing, because time really is brain, and every second that goes by that the brain is starving for blood flow, waiting for TPA, every second that goes by, you lose brain cells. Functional outcomes as a result of Target Stroke have really gotten so much better because patients are being treated faster. So if we could treat a patient 10 minutes faster, 15 minutes faster, that could be the difference of knowing your own image in a mirror. I mean, that could be knowing your children's names. I mean, that is life-changing for people. I think a positive part of working with the American Heart Association for us is the resources, all of the webinars, all of the educational resources online, even the patient information and education that we do with our patients at Cedars-Sinai, essentially all comes from the American Heart Association. So we utilize all of those resources, both online and even in terms of calling them for a question or a concern, or what do we do about this? Or they're really unbelievably responsive. They'll answer immediately. I know if it was a family member of mine, I would want them to come to Cedars-Sinai for their stroke care, because I know that they use Target Stroke initiatives. I know that they work closely with the American Heart Association. I know that they have the finest physicians and nurses around. And all of those things together, it's not just one thing, it's all of those things.